Hi everyone. Gonna joining a couple minutes early to make sure that everybody has a chance to get on all the different platforms. We're live streaming from Facebook, YouTube, Circle, LinkedIn. And so I just want to give a second or two so that people have a chance to join, get a cup of coffee, get a cup of tea like myself, and just be able to listen in. So just want to say hi. And so hope you enjoy a little chill music on this Thursday evening as we wait for everyone to join us. So I want to appreciate everyone who's out there on LinkedIn. LinkedIn has been a fun place for me to meet lots of different people all around the world who has the same interests as myself in terms of coaching and healthcare, organizational development, psychology. So I just want to give a shout out to my LinkedIn family here on YouTube, Facebook, and Circle. So just giving a second for that people can join us so that we can start at the top of the hour. Hopefully all of you are doing pretty well this hopefully sunny April evening for you, and you got your cup of tea or some water, or you got an earbud in and taking care of the kids and going for a walk and enjoying the fresh air and sunshine. So we're just going to give another minute or two for everyone to join us. I really want to appreciate my LinkedIn family here because they're the ones who filled out the poll, ask what in the world should our new LinkedIn Live events be about. And so I sent out a poll a couple weeks ago, and I'll be continuing to ask all of you what you want us to talk about. We're here to support leaders, frontline healthcare professionals, and become a more well, sustainable place to be and work. I want healthcare to be there for me when I get older, and to be able to care for my friends and family. So it's really important to me that I take care of all of you out there, the healthcare professionals and the healthcare leaders that are out there. So we're going to start again in about a minute once the top of the hour starts. But again, welcome if you're just joining us live. We're live streaming on Circle, Facebook, YouTube, and LinkedIn. And I am not 100% sure I'll be able to totally see all of your comments. But if you want to try to comment, I would appreciate it so I can see whether or not I can see it. So I think I can see it on LinkedIn on a little bit of a delay. And I'm not 100% sure it translates over to where I'm actually streaming from. But if you want to help me and test it, go right ahead. So thanks everyone for joining. It is now 8 o'clock, so I'm probably going to go ahead and get started here shortly. So just give another second or two for people to join us. And just wanted to say hi. My name is Lillian Liang Emlet. I am the founder of Transforming Healthcare Coaching. We're a coaching company that supports frontline healthcare professionals, healthcare leaders, and executives in order to transform healthcare one person at a time. And I'm really appreciative to my LinkedIn family for filling out the poll as we come back to LinkedIn Live events to figure out what should we talk about. And so this was actually voted upon by you, my followers and the people of LinkedIn. And so our very first topic for tonight is all about how coaching and can coaching prevent or reduce or help in burnout. And so if you're listening on LinkedIn, feel free to drop a comment. I may not see it right away. I'm not 100% sure all the streaming software allows that quickly, but go ahead and I eventually will see it and I'll respond to you. So if you could go ahead and please go ahead and leave a comment and say hello, or where you're listening in from. Same thing for YouTube. YouTube listeners, we appreciate you, and we're appreciative that you're listening to us via our YouTube live channel where we host our podcast, and you'll be able to see all of our weekly content from the Transforming Healthcare Coaching podcast. And shout out to Klaus Grimm, our podcast director. So without further ado, I'll go ahead and get started with tonight's talk. All of you voted for us to have our very first chat, these LinkedIn Live events on coaching and whether or not coaching can actually reduce burnout in healthcare. And so we're just going to go ahead and get into the evidence and see whether that is true or not. So let's go ahead and get started here. So our objectives for tonight are to go over the evidence to see whether or not there is any data literature to show whether or not coaching and coaching interventions can help burnout related measures. We're going to define coaching as an intervention and what that actually is, and discuss the challenges and solutions for preventing burnout with coaching. And so, first things first, we all need to come to agreement on what exactly is coaching. And as defined by the ICF, it is a thought provoking, creative process that inspires the participant to maximize their personal and professional potential. And so, it often gets confused in some professional circles with it's not therapy, it's not mentoring, and it's not advising. And so, coaching has a very specific way it's conducted so that the individual is able to, with questioning, find a solution to their problems. And so I want to make sure we're all clear on what the actual intervention is. So there actually is quite a bit of evidence related to uh, how coaching interventions have been studied in the healthcare arena. There have been multiple randomized controlled trials, and there's been some quasi-experimental studies. And I really want to first highlight and feature the one systematic review by Boet et al. In PLOS 1 in 2023, the impact of coaching on physician wellness, a systematic review of out of 2,531 studies, they actually picked 14 that qualified. So they only reviewed 14 studies. 5 of them were randomized controlled trials. 2 were non-randomized controlled studies. 4 were before-after studies. 2 were mixed methods, and 1 was qualitative. And in total, in their systematic review, they had 1,099 participants across all the studies included. And again, this is a physician-centric study, and they included any interventional design that involved licensed physicians of any specialty undergoing coaching by a trained coach, delivered individually or in groups. And the studies all needed to assess at least one outcome measure related to well-being. And those things could have included things like quality of life, resilience, psychological well-being, distress, or burnout. And the coaching intervention had to meet the internationally recognized definition of coaching with the core competencies as described by the ICF. And that's important as you select a coach and you want to make sure they meet the standards of the international definition. So they actually found that coaching by trained professionals improved well-being and it reduces stress, distress, and burnout. All of the RCTs show stronger evidence. The non-RCTs obviously had a little bit less weighted evidence in terms of and a little bit of bias risk. And the limitations was the heterogeneity in how coaching was delivered. I described it could be individual or group and all the different various ways that you could look at outcomes. And so their conclusion from this was that there needed to be a little bit more of standardization and long-term follow-up. And so they concluded in 2023 that coaching is a very promising, underused, under-researched physician well-being initiative. And I think all of us would probably agree if we're listening in. As compared to, we're going to just go into each of the big studies that are probably the classical evidence that you will hear about why coaching does work for healthcare professionals. And I will admit that this is a very physician and nursing centric talk. Most of the studies have been weighted primarily in physicians. There's also been concurrent studies in nursing with very different interventions, and all of it suggests that there is a benefit for improving clinician well-being. But a landmark one back in 2019, before the pandemic, published before the pandemic, was by Dr. Derby at the Mayo Clinic. And this was published in 2019 in the JAMA Internal Medicine, and the effect of professional coaching intervention on the well-being and distress of physicians. And this was a pilot RCT of 88 physicians across the Mayo Clinic sites. They included 6 sessions, which was a total of 3.5 hours total time of individualized coaching over 5 months by certified external coaches, meaning external to the Mayo Clinic. And their outcomes were that they decreased emotional exhaustion. It had and also decreased the burnout by 17% in coaching in the physicians that were coached, as compared to there was an increase in burnout in 4.9, almost 5% in the controls. And so they also found that quality of life improved and the resilience also improved, but only a little bit. And this was our very first study back in the day of the idea that maybe coaching could be an intervention for well-being and to be able to treat burnout. And so The coaching provided physicians a structured space to reflect, align values, and build personal agency. And so, professional coaching, external coaching, significantly reduced physician burnout and actually enhanced their well-being in a very short time frame, and that's within 5 months. So that's probably one of the first studies that came out to really show a really robust effort. Simultaneously, in the Netherlands, there by Solms et al. And BMJ Open, this is called Turning the Tide, a quasi-experimental study on coaching interventions to reduce burnout symptoms. This quasi-experimental study looked at 57 physicians versus 57 controls. So, a moderate-sized number of pediatric residents and specialists in the Netherlands. And their outcomes were that they decreased exhaustion significantly, and there was increased psychological capital and self-compassion. And so coaching effectively reduces the burnout symptoms, and it builds protected personal resources. And this was one of the first controlled field studies showing benefits in both resident trainee physicians and specialists attending physicians. And so this again was specialty specific in pediatrics, and it was in a different country. And so potentially it's another replicatable study back in 2020 in the early days. So these were some of the earlier studies. Moving on to other types of physicians, Derby et al. In the Annals of Surgery had a paper called Professional Coaching and Surgeon Wellbeing, a randomized control trial. And in this, with 80 surgeons, a randomized control trial, there was a 6-monthly individualized professional coaching sessions. And their goal was to look at the impact on burnout, quality of life, and resilience. And they decreased burnout by 2.5% in the intervention group, while in the control group, the burnout actually increased. Resilience also increased in the coached group, and then there was only a very slight decrease in the controls. Really, not that much difference. In 6-month follow-up, what was interesting is the surgeons' burnout levels returned back to baseline, but the resilience persisted. So the skills that were gained by the surgeons from the coaching actually persisted, if we believe the resilience measures that we're measuring here. And so there actually was an interesting thing that they found, that the surgeons who actually received the coaching later in the program had more decrease in burnout compared to those that were no longer receiving the coaching. And so they felt that really their conclusion was that it leads to measurable short-term improvements in burnout, and that sometimes maybe the benefits might diminish over time, and that it might need to continue actually as a continued support mechanism for the intensity of the career. In pediatric surgery trainees, a more recent study in 2024 by Huang et al. Is a coaching program to address burnout, well-being, and professional development in pediatric surgery trainees. And this is another randomized control trial. This was with 43 pediatric surgery trainees or residents during the COVID-19 pandemic, and they were randomized to quarterly one-on-one virtual coaching or just reading some things about wellness, which is probably what majority of people have available to them right now. And this was delivered by trained pediatric surgeons using positive psychology principles. And their outcome measures are very positive psychology or strengths-based coaching modalities. And so their well-being or their PERMA index has significant improvement in their well-being scores. They showed improved gratitude scores, and they showed a significant reduction in burnout with the trainees that were coached as compared to the ones that were not coached. And so the coached trainees actually reported better coping skills with the work-life balance, administrative burdens, interpersonal relationships, self-confidence, and it really provided an opportunity for reflection. And there was more improvements with burnout self-evaluation. And so the insight here is that you can actually do this even in the training pathways. And so this was the beginning, just like many other papers who have subsequently looked at this, to use coaching within training programs to be able to impact physicians earlier in their career, especially during a high stress time like the pandemic and during training, where the work hours are longer. And as we know, there is greater amounts of burnout in training compared to practicing physicians. Another paper by Kaiser, Palamara et al. In JAMA Open was physician coaching by professionally trained peers for burnout and well-being, a randomized clinical trial. And so all of the previous interventions were external coaches, coaches that are professionally trained, certified, and now there's been so much interest in coaching that there's are many training programs where we train internal coaches, meaning clinicians within the healthcare system, the organization, are willing to invest a significant amount of education for their healthcare professionals to be able to keep all of the coaching services internally to the organization. It's a long-term strategy to invest with people who know and understand the culture of that organization. And there's been many sites that have done this. Uh, and so this was the first study to show the effects and the outcomes of this. So this is a randomized control trial with 138 physicians at Mass General. The peer coaches, meaning clinicians within the system, were trained and certified by the Well Coaches Company, an ICF accredited training program. And 6 individualized coaching sessions were delivered over 3 months. And they saw significant reductions in overall burnout and interprofessional disengagement, increased professional fulfillment, and increased work engagement. Burnout went down by 21%, professional fulfillment went up by 10%, and less interpersonal disengagement went down by 30%. And so their conclusion is that training peers to be peer internal coaches is an effective, accessible intervention for organizations to invest and have a long-term strategy to improve physician wellness and reduce burnout within the organization. And so in terms of other types of disciplines, uh, in primary care, we all know that primary care and outpatient-based high volume practices have a significant amount of burnout related to the practice of outpatient medicine. I have covered mostly inpatient practices thus far. So McGonigal et al. In the Journal of Occupational Health Psychology did a RCT as well. This was coaching for primary care physician well-being, a randomized trial and follow-up analysis. And this was an RCT of 59 primary care providers, and they followed up 6 months later. And so this one included 6 positive psychology-based coaching sessions. So much of coaching is foundationally, from a theoretical perspective, grounded in positive psychology, which you've heard me mention more than once now tonight. And so then this RCT with primary care physicians, there was decreased burnout and also increased work engagement, job satisfaction, and psychological capital. And they reassessed at 3 months and 6 months. And with their intervention, there was still sustained benefits that far out. And so this was one of the first RCTs to look at coaching's longitudinal impact on primary care providers' well-being. And so as you see, each study has a slightly different flavor and a take, and cumulatively, they all fed into the systemic reviews, showing that there is benefits in terms of addressing burnout, in terms of preventing and also reducing those symptoms. So some things to keep in mind in terms of the components of what all of these coaching interventions had, in terms of what is similar amongst all of this. And so much of it is the fact that, like I said, at the very core root, positive psychology is the theoretical basis behind coaching questioning and modalities, whether it be individual or group or team. There's also a huge component of personal development. These are individualized to the clinician. And so the focus is on personal growth, personal motivation, and really individualizing the solution for each person. It does require trained professional coaches, which most coaching programs are anywhere from 6 to 9 months and have ICF or at least accredited standards in terms of observation, recording, feedback, and testing of the competencies required of the ICF for professional coaches, and highly individualized. And so meeting the diversity of the healthcare workforce, coaching can help with that process, because everyone's road to burnout is a unique road to burnout. And so the outcomes measured in all these studies were various, right? Some of them were burnout metrics, which classically is some measured well-being indicators like quality of life, resilience, professional fulfillment, the PERMA index. And they also did qualitative assessments in terms of personal feelings of self compassion, gratitude, and the impact on their profession. And so all of these studies had more than one outcome that they looked at for the intervention and the strength and the duration of the effects of the coaching. So when we look at coaching techniques that are studied in physicians, what we've covered so far is the fact that they're mostly individualized interventions. They mostly all do focus on some degree of either a positive psychology or a strengths-based modality of coaching. Some of them did also include groups, and some studies also included peer support and training people to be peer supporters on trained colleagues within internal coaches. In comparison, techniques that are studied in nurses have taken a different slant. So this is a summary of several other papers. Nursing literature and nursing profession have chosen to look at different ways that these techniques can be used for improving well-being in nursing professions. And most of the studies have an intervention have been studied for well-being for nurses have been under the umbrella of the mindfulness-based stress reduction. Yoga and mindfulness again, yoga, physical activities being mindful movement, and then also professional competence education, enhancing clinical skills and leadership skills and diversifying their professional development. And so those are the three main bucket that most coaching or well-being interventions in nurses have gone. So slightly different in terms of what physicians versus nursing arenas have available for coaching. So there are barriers to implementation. And so thinking through the challenges for organizations, divisions, and practices to implement coaching within your group will be things like time constraints in terms of limited availability for sessions. Like when do you schedule these? During your workday, during your off day? And if you do it during the workday, include it as part of your professional development package, especially for even for people like executive leaders, it's hard to always find that time. So there's always a time constraint. Also, staffing issues. Do we have the luxury and do we budget for enough staff so that when during highest workloads, can we still peel away? Or are we always pulled into the next emergency? And there's always a staffing emergency, no matter what discipline, field, or profession you're in healthcare. And so how do we think through those things as leaders? There's also a significant frontline unawareness or maybe stigma or reluctance to seek help that in general, as caregivers, we often don't want to get care ourselves. And we often forget to go get our physical or mental checkups, much less a growth oriented thing like coaching to be able to, it's almost like a luxury. So if we can't even take care of the basic fundamentals of physical mental health with therapy and seeing your primary care physician and making sure we eat healthy and move our body, sometimes it's really hard to be able to be aware that we also may benefit from something like coaching. And then organizational support. Many organizations don't have access to these, or they're reserved for people in a certain career tracks. And so it's not really well publicized, or many employees are just not aware of these things, even if HR does offer these opportunities. And so these are many barriers in the healthcare arena. And then if you're in private practice, oftentimes this takes quite a while before your practice is able to have the extra profit to be able to think about using coaching to be able to improve the operations of your private practice and your conglomerates. So the question is, how do we overcome the resistance to coaching in healthcare? I mean, and it does require organizational support. Leaders who have coaches often don't talk about them. And I have to, even for me, I didn't really realize the power and the strength of coaching in my own career development until I was in other women in medicine, small group coaching mentoring sessions. And they actually talked pretty frankly about the fact that they all had a coach. So all of the division chiefs and chairs all have had coaches. And so until I was aware that this was an opportunity, and I started talking to other national colleagues, they also have sought out a coach. And so one is just having the support to be able to disseminate that type of information, either through HR, employee assistance, your own professional growth programs within your arenas and the people that you're leading. And also creating a coaching culture. So now many healthcare organizations are actually leading the way by creating the leader as a coach programs. And a good friend and colleague of mine is leading the way with this in over on the West Coast, with creating a coaching culture within their division, their department, where a few people are trained to be sort of the go-to coaches for their internal department. And then followed Dr. Palomara's lead with getting training brought in as a long-term investment for the group. Other ways are tailoring the programs where specifically for the women physicians across the system, or for certain groups, to just tailor it to a growth need within the organization is another way. And then really just policy, just really looking at your HR policies, working with them to make sure we have buckets of dollars allocated, both from a time and staffing perspective, and also just the fact that when we onboard employees, we do like an annual check-in, and we target the people who are first joining our organization within a couple months to reach back out and make sure that they are aware that there are resources like coaching available to them within the organization, either internal or external. And people have talked about different ways you could possibly incentivize this. And so when we think about how can we incentivize the culture to change in healthcare so that we can actually have more healthcare professionals seek out, be curious, and actually go pursue coaching for themselves. One, it could be financial rewards, right? So giving some dollars reserved every year for a few people in your department to get coached is one way. Um, Increasing professional education dollars, like CME dollars or CEU dollars, or programming is another way. Making sure that in the programming that you've allocated in your budget is to actually increase a bit so that you can actually include coaching as part of that, whether that be group or peer. And because coaching, as we saw from the evidence in the literature, that it does really take multiple repeated over time for at least probably somewhere within the 6-month range, because all of the studies had interventions that lasted for a period of time. There's something about the cadence of accountability and reflection and the habit formation of the coaching practice that the benefits really are seen not as a one-off, like going to a conference or going to a workshop. Coaching really does have its greatest benefits over time. And so trying to figure out how to be able to sustain protected time as a group with extra staffing, with figuring out when and what times of the year that coaching can be something that can be participated in is another thing. And then also really normalizing that as part of career advancement. I am still amazed by the number of clients that we have who are surprised about coaching in general in their career trajectory as they have been promoted more than once. And they never were offered things like 360 evaluations and coaching, and to really make sure that we leverage our human resources colleagues and also our national colleagues and companies like us to really offer different opportunities for your employees. And then last but not least is organizational support, to really promote and begin to normalize the culture. I think it's I keep forgetting to tell people that I have a coach. Yes, so coaches actually have coaches, and it is normal to have a coach. I think when we actually promote and actually can talk about these things at an organization, that this is a normal good thing for your career development, just like getting another degree, getting another certificate, or going to a particular workshop or program. Coaching is just one of the many ways that we career develop over time. The unfortunate thing about there are always side effects and incentives, right? So I think we all know quite well in healthcare that if you incentivize something, then sometimes you get perverse things that may happen. And one thing, when we throw too much free money at the problem, it may decrease intrinsic motivation of the person who receives the coaching. So coaching is something that you have to voluntarily want to do. You should not force people into coaching. It is not to be forced for a punitive reason and for correction reasons or remediation reasons. And also just throwing money at the solution and paying someone when they don't want to actually have the coaching isn't going to help anything. And if anything, what money you pay for, you pay attention. So when you plunk down that money yourself, you actually are very focused in terms of what you want to get out of that situation. And when we think about this, no different from if you hire a personal trainer, um, you are actually paying attention and you are going to make that appointment because you paid money to be able to get the outcomes you're looking for. So there is some downsides for some of these incentives. The other incentive is also for staffing strain. If we normalize and we actually do all of this, we actually may put greater strain on all of our other colleagues. This actually may cause some degree of resentment, especially because it's unlikely or it's very challenging to give coaching to 100% of your employees at any given time. And so figuring out what that staffing and what that strain and how much your group can even tolerate. I would probably say most groups right now can't tolerate time protection very well. That becomes a challenge. The other thing too also becomes competition. Anytime we have a situation where we're competing within the organization to get certain resources that are considered coveted, they actually may create some degree of division. So incentivizing it that way also may have its downsides. And then for internal peer coaching, there hits a limit that sometimes at some point that internal peer coaching people may not be able to get as much benefit because they may feel there are some limits in terms of what they feel for confidentiality, what they be willing to disclose, as compared to an external coach who really has no relation or into the organization. And so obviously the whole reason why, aside from an individual level, to reduce and prevent and treat the burnout that you may be experiencing is really from a bigger picture perspective, is that when we are well as healthcare professionals, we provide better patient care, right? And so we know that in order to provide at scale professional development, we need to protect the patient care delivery. And that's going to mean a lot of attention proactively for looking at how can you schedule more strategically, have staggered participation in different divisions or groups, maybe hire in some temporary staffing for half of the year, planning for the fact there's a lot more professional development. This goes with not just with coaching, but also with educational interventions that you're offering within internally for your organization, and then making sure you have efficient workflows. And so that's step number one as a leader, is trying to figure out how am I going to create the environment that can even offer coaching. And when we think about high workload, we have to be really strategic with how we schedule and involve all of our frontline leadership. We need to think about making sure this is equal across our organization, where you can have staggered participation across the organization and make sure you can rotate the opportunity. And you might even really budget ahead of time that we need to have more people on our roster than we actually need, because the goal is that we're going to have not only medical illnesses, professional development, educational interventions, and also coaching interventions that will help the culture and the group stay cohesive, and be able to cover for each other and not feel the stress. And then obviously making sure all of your workflows are able to handle all of this. And what we would love to say that if you intervene to give a coaching intervention to your organization, then boom, all of these, outcomes will be great. And I wish I could say that. The reality is, these patient care quality measures are the lagging indicators, right? These are affected by so many different things that we're measuring in terms of the system, the process, the quality, and this is a contributor. The clinicians themselves are a contributor, but they are a lagging measure. And so what we often find is that burnout reduction of the individual, the professional fulfillment of the individual, are the leading indicators, meaning that if this is well, then these will also rise. And so that's the greatest challenge, is trying to understand the balance between the two and making sure that you're measuring all of these things at the same time. And it takes a while to watch change and to be able to sustain change. So for all of the change and organizational psychologists out there and the change management people out there listening, you know exactly what I'm talking about, because as you consult with large groups, it really takes a lot of people over time to be rowing all in the same direction in order to kind of move faster. And it takes an army. So the takeaways from tonight, from looking at the evidence in the literature for the types of coaching interventions that are out there for physicians and nurses, there is evidence for why coaching is a good intervention to bring into your into your team, your group, and your organization. There's been RCTs and also non-randomized trials, and they're all showing the same signal. The tailored approaches are different. So they all, in the end of the day, do require a trained, certified professional coaches. You want to be really careful in how you protect your patient care, making sure that you're measuring, have a baseline measurement of all the different ways for burnout and resilience and gratitude. And I'm hoping you enjoyed this whirlwind review of the literature for and the evidence for why coaching can help and reduce and prevent and treat burnout in healthcare professionals. And so please feel free to stay in the loop. So I just want to let you know that my email is hello@transforminghealthcarecoaching.com. Subscribe to our weekly newsletter if you want to go ahead and scan the QR code. Email me if you would like to list of all of these references. You want all of the articles that I've cited and quoted here tonight. And I also want to let you know about for the frontline people and also for leaders. We have a program called MedThrive at Transforming Healthcare Coaching, and it is a private online community where we provide little small tidbits of the well-being curriculum, an online private community, and also group coaching every month. And so we would love to see more organizations consider us for, you don't have the time or the energy or the internal resources to develop a well-being program. We have it ready for you. And so I'd like you to consider whether or not you yourself can have individualized coaching and or group coaching within our MedThrive community. And so contact me to stay in the loop, and I will take any questions that people might have. And so I'm going to see whether anyone's chatted anything. Let's see. I don't see any comments in the chat, but I just wanted to say thank you all for coming tonight. Thank you for listening. Thank you for being curious about the evidence related to coaching and its effects for healthcare professionals. Obviously, specifically, mostly studied in physicians, and then a little bit less so in nurses. And also for the leaders out there, thinking through how might you begin to strategically plan with opportunities with your HR group, your budget line, to be able to bring coaching to your healthcare practice. So thank you so much for listening. And together we can transform healthcare one person at a time. Have a good night, everyone.